So if you're interested in becoming a medical social worker, in order to become a good medical social worker, you have to be able to learn how to read and navigate medical charts. This is where we get the most of our information to help us determine a treatment plan and discharge plan for our patients. Hi, my name is Tabby, and I'm an LCSW with over 13 years of social work experience in the healthcare field. And I'm here to bridge the gap between what you learn in social work school and real-world experience. Knowing how to navigate the medical chart and knowing exactly what to focus on in that chart is what's going to help you coordinate care more efficiently. If you watch the video that I made on how hospital social workers complete or condense biopsychosocial assessments, you will see that in that video, I talk about how different parts of a patient's chart is going to give you the information you need in order to complete part of your biopsychosocial assessment. So in this video, what I'm going to go over is kind of what to expect a medical chart to look like as far as what components are involved in a medical chart, and really more focusing a little bit more on what parts of the chart you may want to focus on as a new medical social worker. So as a medical social worker, you're going to hear a lot of different acronyms. The acronyms that I'm going to be talking about mostly in this video is related to having an electronic medical record. So those acronyms are going to be EMR or EHR. EMR stands for electronic medical records. EHR just stands for electronic health record. They're used pretty interchangeably. But just so that you know, if you're seeing two different acronyms, that's what that means. It's referring to the electronic charting system or medical record keeping system. Interestingly enough, although that we have been in the age of technology for quite some time now, we have just actually fairly recently caught up in the medical world. So actually, electronic medical keeping wasn't actually mandated until 2014. So it's been a few years now, and we have really made a lot of strides in a short period of time. And we're finally at an era, I think, where the majority of healthcare systems are using electronic medical record keeping. There might be a few that are still stragglers that are coming along. A lot of those are going to be rural communities. But for the most part, all large hospital systems or healthcare systems are using electronic medical record. So you're not flipping through a patient's physical chart that you used to have to do. Now everything should be online. With that being said, depending on what medical setting that you are going to work in, you might have different types of software that you're using for those electronic medical records. And some are going to look a little bit different than others. But overall, the overall components of all of those medical charts are essentially the same. So that's what I'm going to be going over with you today. Now, if you're going to be working in a larger healthcare system, some of the most popular that you might end up working with are going to be ones like Epic, Cerner, MedHost, Meditech, Athena Health, and Allscripts. Those are like the most popular ones in the nation, or at least in the United States, that are used for the electronic medical records. There are some other ones out there. Depending, again, it's going to depend on your medical setting and depending on your location. So these are just some of the ones that I have personally used. And so that's kind of where I'm going to be getting some of my information, and it's just based off of my experience.
So I wanted to give you an idea of what an electronic medical record might look like for you. Of course, it's different, but for the most part, it's going to be generally the same. So all I did was I Googled Cerner electronic medical record and then looked at images. And this is like a screenshot that I found on Google from Cerner's website, I think, or softwareadvice.com, I guess. Anyway, here is an example of what it might look like. As you can see here at the top, you're going to see a lot of the patient information here, and then you're going to find tabs on the left. Some medical records, you might have it on the left, some might have it across the top, or both. Anyway, these are the tabs that you're going to look at. These are going to be the different sections of the medical record. So here you're going to find patient information summary. That's probably where you're going to find the patient face sheet. And then we've got clinical notes, and that's probably where you're going to find a lot of the progress notes. So including notes from physicians, maybe specialists, maybe that's where they have specialty consults. You'll probably find rehab therapy notes there. Case management notes, social work notes are probably going to be located in there. So in general, that's where you're going to find a lot of progress notes from healthcare providers. Then you're probably going to find the histories. That's probably where you'll find the history and physical, although you might find that in clinical notes as well, just depends. You're going to find the medication profile here. Again, that is the MAR, the medication administration record. And you'll find pathology, microbiology, radiology, diagnostic reports. That's going to be your images, your labs, your diagnostic reports. We'll kind of go over that a little bit more in detail here shortly. And then here you got your orders. So that's another section that you're going to want to look at as well. That's where you're going to find the physician orders.
Let's talk about the face sheet. So the face sheet is actually a snapshot of the patient's information and care. That's going to include their demographic information. It's going to include emergency contact information, maybe who is designated as a power of attorney, healthcare proxy, those kind of things. It might also include their admitting diagnosis, and it should also include their admitting status, whether that be inpatient or out or observation or outpatient.
This is my fake face sheet with the Hollywood State Hospital. I just kind of like made that up. I don't know if it's real or not. I just made that up. Anyway, so as you can see here, this is what a face sheet gives you an idea of what a face sheet might look like. So we have, like at the top here, we've got the patient's information, like their name. It'll tell us their code status. A DNR, that's do not resuscitate. It might say that, or it might say full, which would stand for full code, which means they want to be resuscitated. It's going to have their age. It's going to have their medical record number or some kind of identifying number for them in the hospital. You're going to see their room bed location there. You are going to see that who their attending is, so meaning who's their physician that is going to be overseeing their care while inpatient at the hospital. Here's their status, that's inpatient. It'll probably have maybe PCP information, like their primary care provider information, or the admitting provider information. Should have admission date. Sometimes you'll see an admitting diagnosis, but not all the time. They also have their residential address, a mailing address. It might have their contact information, employment information. Here you'll definitely see insurance information. So typically there's going to be a primary insurance. Sometimes there's a secondary insurance, but that's where you'll find this information, is typically on that face sheet. Then we also have on this one the emergency contact and a next of kin. Those are not always the same. Sometimes they're different. Sometimes the next of kin or emergency contact should let you know whether or not they have healthcare power of attorney or are the healthcare power of attorney or financial power of attorney or healthcare proxy, but not all the time because not everybody has one. So hopefully that gives you a little bit better insight of kind of what a face sheet looks like or what you can expect one to look like.
And then I'm going to just go ahead and pull up what a history and physical looks like.
The medical history and physical is going to be an important part or important place for you to get a lot of your information for the psychosocial evaluation. So here's an example. This is just a fake history and physical that I created. And this is, so you're going to have the patient information up here. In general, this is what it's going to look like, but you'll find that they have a chief complaint. You'll find out their presenting illness, what they came in for, maybe a history of what they've come in for in the past. You'll probably find, you usually are going to find any past medical history, past surgical history. There might be a brief social history. although I wouldn't rely very much on that. Most doctors don't really complete that very much, which is fine. Then you're going to find the physical exam data information, so the vitals upon admission. Down further, which is really what you're going to want to look at, is you're going to find the assessment and plan. And that's really what you kind of want to focus on in the history and physical. And honestly, probably in any of the progress notes from physicians, is you want to look down to the assessment and plan. That's where they're going to give their recommendations of kind of what they think is going on with the patient and what their plan is for treatment. So that'll give you indication of what you might need to start looking for to plan for care coordination. Even though it might be the first day, it just gives you an idea. So that's what I would do. So that's in general what a history and physical generally is going to look like in a chart.
So another part of the medical record is, of course, the medication list. And that is going to be known as the MAR, which stands for Medication Administration Record.
So I just kind of created this fake administration record, or also sometimes it's called medication reconciliation. So, or MedRec. Anyway, so I'm just pulling that up here so you can have an idea of what that medication list could potentially look like. Obviously, it's going to be a little bit different just depending on where you work, but in general, you're going to get the general idea here. So typically, it's going to tell you that it's the medication list or rec. It's going to have the patient identifying information up here. Then we also have on this one, active medications. So active medications, or it's going to say inpatient medications, is going to be the medications that the patient is currently on while they're in the hospital. So over here, you're going to have a list of what the name of the medication is. It should also have a diagnosis or the reason for that medication. So for this one, like example, propanolol, the diagnosis for heart failure. It's also going to tell you the dosage and the route. And when I say route, that's going to be how the medication is administered. So typically you're going to see an oral administration, which is PO, or you might see inhaled. So that's an inhalation form that's how they get the medication. So like an inhaler or maybe a nebulizer machine. Then we also have other parts would be like IV. So through the intravenous way, the IV. And then also SQ, which is going to be under the tongue, sublinguous. It's for under the tongue. So those are going to be probably your main ways that you'll see the route or how the medication is administered. So that's what that means there. It'll tell you the dosage. And then it should also tell you when to give it. So HS is going to be at night. You're going to have a time frame. So this one's every 6 hours as needed, every day, twice a day, 4 times a day, 3 times a day. So it's going to tell you how it's being administered and when it's being administered. Sometimes you might see some extra notes on additional information specifically for the nurses. Like, for example, for someone who has diabetes, they might need to look at a sliding scale. There's certain percentages or there's certain numbers that they have to utilize in order to determine how much a medication to give and when. So hopefully this gives you an idea of what the medication list can look like.
So physician orders are really just the physician's ways of communicating what kind of care the patient needs. So healthcare professionals like nurses, med techs, assistants, like medical assistants, just any staff that is involved in direct patient care, use those orders to carry out whatever care that's being recommended by the physician. And really, it's not necessarily supposed to be considered a recommendation. Like, it's an order, like it's mandatory that it needs to be done if it's done by a physician, if it's ordered by a physician. But for why it's important for you as a social worker to see the physician orders is it can be helpful for you to determine kind of what their their dietary needs are, what's being ordered for them. That'll give you an indication on if they're on like a liquid diet. They might not be ready for discharge because typically, depending, especially after a surgery, you might want to try to get them back to a normal diet. If they're on a normal diet, but like it's a specialized diet, that might be good for you to know. And then that way you can also reiterate that information or pass that information along to the nursing facility or whoever's going to be providing the aftercare after the hospital stay. That's also probably where you're going to find the discharge orders that you are going to be needing to send to the agency or facility for further care coordination when the patient discharges.
Then we have the labs and diagnostic reports. So we have here, this is just, again, this is fake. I just made this up and created it. But for example, like this is going to be in general what maybe the laboratory test information is going to include. So that's going to include information like urinary analysis, blood work, pathology, and it's going to tell you a bunch of different stuff. You're not really going to necessarily need to know what any of this means. Like you're not a doctor or a nurse that has that kind of medical degree. So this isn't going to be as pertinent to you, although as you get to know how things function in your setting, you might learn some of these things. The biggest thing that you're probably going to be looking at though is if you are looking at toxicology screens. So like if they have the urinary analysis or UA done and it comes up as they have a drug or alcohol in their system, usually then that kind of triggers a consult for social work to go in and do some motivational interviewing and provide them with substance abuse resources. So that's probably the only time that you're going to need to use the labs part of thing. Although you also might need to have them in order for, I don't know, like home treatments for the home health agency or setting up dialysis treatment. But I wouldn't worry too much about that unless you're specifically having to look for certain things. But in general, you're probably only going to look there for the toxicology screen. And then for special reports, this is going to be kind of the imaging. So MRIs, the CT scans, interventional radiology when they do any kind of procedures or placements, like putting in a catheter in the arm or in the chest or anything like that, any kind of placement that way, you're going to find the radiology data here. Also, you'll find chest x-rays. So chest x-rays and CTs are going to be probably something you'll get used to because you'll need those for placement, facility placement, or for a patient to receive certain services like dialysis or TPN or just medication at home kind of thing. So those are typically necessary and something that you will want to find where it is and get the information on it to make sure it's clear. But otherwise, those diagnostic reports, those flow sheets, you're only going to need to use them if the facility or agency that you're coordinating care for specifically asks for them.
Other parts of the chart are going to be nursing notes. You'll find things like nursing vitals. You'll find their assessments. You'll find skin assessments that they do upon admission and then intermittently throughout their hospital stay. You'll find intake and outtake, which is going to be the amount of food or fluids that a patient intakes and then what their output is. That's usually only helpful for, they have to have a certain amount of output, especially if they're going to be going to a facility. They want to make sure, we call it the brown ticket, brown ticket to go. So just making sure that they have a BM before they discharge in order to go to a facility to make sure that their bowels are running correctly. So that's part of that. And then, of course, then there's the MISCs, so miscellaneous. So you've got the advanced directives that are going to include healthcare power of attorney or healthcare proxy, sometimes financial power of attorney. You'll also find if they have a guardian, you should have guardianship letters in there, conservatorship letters. You're also going to find their code status or their CPR directive, the do not resuscitate, or if they want to be resuscitated. And then you'll also find any kind of consent for treatment forms or HIPAA consent forms or release of information forms there as well. In future videos, I will make sure that I go over maybe more in depth of what to expect different parts of that medical record to be like, and maybe go into more depth about, what rehab therapy notes look like and what to really focus in on there, what to kind of pinpoint for your psychosocial assessment, and also for your discharge planning too. So be on the lookout for those videos. And if you like this video and you want to know more, you want to hear more, please subscribe and hit the notification bell so that you can be notified for future videos. Also, please make sure that you sign up for the Medical Social Work Mastery newsletter so I can send you updates on new videos, some other tips, resources, and I do try to send out some freebies too. Thanks so much for watching, guys. I really appreciate it.